for coming in today.
Oh, right. Well, thank you for seeing me.
Oh, no problem. Have you seen anybody else today?
Dr. Patel.
Okay, got it.
I had a question.
Yeah.
I wanted to get a second opinion.
Okay.
So I noticed that they're making a lot of revisions to how they evaluate kidney patients.
Okay.
So from inside the packet that I got, there were it was like a brochure or a packet about possibly getting like damaged kidneys in order to get a kidney sooner.
Yeah.
Do you know what I'm talking about?
So they're not damaged kidneys. We would never give you a damaged kidney.
But you know what I mean.
Yes.
Right.
High risk. They're higher risk. Potentially, there's a couple different ways they can be high risk. They can be high risk from the standpoint of infection, such as hepatitis C, hepatitis B, or HIV.
Right, that I'm aware of.
Okay. And that's from like drug use or exposure to certain things in the past. It could be a risk based on their habits, not necessarily based on anything else. You know, no positive tests. It could be that they have hepatitis C and you're willing to accept a hepatitis C kidney, but accept that it will require further treatment to cure the hepatitis C after you received a hepatitis C that gives you hepatitis C.
Right.
And then the one that you're talking about is there's kidneys that have high creatinines at the time of procurement or donation that are not injured per se permanently, but temporarily, with the hope, and our clinical acumen tells us that they will recover after they've been transplanted. Is that what you mean?
Yes. Because that's sort of what they covered in the brochure, that they rate the kidneys according to like a rating system of like 1 to 100 and.
Yes, so that's the KDPI is what you're referring
Yes.
to. It's a kidney donor risk index, basically.
Mm-hmm.
And that index is based on how kidneys in the past have performed in the future based on a certain group of characteristics. Criteria. Hypertension, diabetes, smoking, creatinine, those types of things in the donor, not the recipient, not you. In the person who's donating the kidney. That number, the cutoff that we use is usually 85%, where the higher the number, this is kind of the reverse of what you
Yeah, I know exactly what you're talking about. Like the lower the number, the better it is. The higher the number, the more high at risk you'll be.
Yes.
Okay.
So you have to basically sign off and say, I'm okay receiving high KDPI kidneys if it helps me get off dialysis.
Okay.
Right? With the understanding that there's a potential that kidney may not last as long. It can, if properly chosen and properly matched, but may not last as long as, say, another lower KDPI kidney.
Okay. That I understand.
Okay.
But my question was, so if I do get, like, let's say I consent to one of these higher risk kidneys. I get the kidney and then I'm taken off the list. Am I no longer like accumulating time, or do I have to start over?
Well, if the kidney works, you don't need to start over. Is that what you mean?
Yeah.
Yeah, the kidney works and you're off dialysis, then you got your transplant. You're not on the list anymore.
Okay.
You're officially, the second that kidney gets blood, you're taken off the list.
Okay. So
almost to the minute.
So say for example, I get the kidney, it's working fine, but the shelf life of this like procured kidney is 5 years.
Mm-hmm. Do you go back to your first date of the dialysis, or do you go to your new date of dialysis? Is that what you're saying?
Yeah.
You go to your new date.
Okay, so I'd have to start all over again.
You would.
So it's not even, so from, like, let's say from your opinion, it's not even worth it.
Depends on how you're doing on dialysis, how you're tolerating dialysis.
Mm-hmm.
If you're tolerating it well and it's not interfering with too much on a daily life, daily schedule, then you might want to consider a lower KDPI kidney. If dialysis is very much interfering with your normal daily life, or you're not tolerating it well, you want to take that higher KDPI kidney. It's not a guarantee, it's a prediction tool that we use to determine whether or not that kidney will last. In general, if it's a well-chosen recipient and a well-chosen kidney, that kidney should last upwards of 10 years. And there's a lot of factors that go into how well that kidney lasts. Sometimes the kidney is destined to last 10 years, but if it's a higher KDPI kidney, it may not be as resistant or capable of dealing with rejection or people stopping their medications or other complications or issues in the future. It's not just the KDPI that goes into determining how long a kidney will last. For example, if you fell off the wagon with your management of your immunosuppression or your management of your diabetic medications or your management of potential blood pressure medications, that will be injurious to any kidney, but maybe more injurious or more harmful to a kidney that has a higher KDPI, theoretically only. There's no study that shows that, right?
Right.
But theoretically only. But if you take your diabetes medications, if you take the immunosuppression, you continue to eat and live a healthy lifestyle, then you may potentially get 10 years out of that deceased donor kidney. And we wouldn't, in your case, that like I say, there's many other factors that go into it. One of the factors is KDPI. The other factors are age of the donor. We're certainly not going to give someone who's 36 years old a kidney that's 76 years old, right? We try to match the age. We try to match the size. We're not going to give you a kidney from a donor who's 4'7" and a petite woman, right? We're going to try to age match, size match, blood type match, obviously. There's a lot of other things that go into it besides the KDPI. And we think too about, everything else is good, but gosh, this 95% KDPI kidney for Mr. Porter is probably not great.
Because I did sign the consent for that.
Okay.
But I just wanted to get more information, just so that way, I knew what that meant, because the whole hepatitis C kidney thing, it came up before. I'm not interested in doing that because I have enough going on. I'm not interested in doing that at all. Those
are usually lower KDPI kidneys, by the way. They're usually quote unquote better kidneys because of the unfortunate and very sad nature of how out there
the kidney was acquired,
or how people get hepatitis C. Right. And usually the demographic or population of people using items or drugs that will lead to hepatitis C is usually younger population, younger people. My job here is not to push you in that direction, only to inform you. The surgery itself, the kidney transplantation, we leave your native kidneys in place. We don't remove those. It's not like changing an engine or a motor in a car.
Like tires.
Yeah. Right. A liver is. We have to make new room for a liver, but you're not getting a liver transplant. We actually end up putting a new kidney in the pelvis. We attach the blood vessels of the donor kidney to the blood vessels of your pelvis. Okay? That gives us a really good way to connect the ureter, which is the tube between the kidney and the bladder that carries urine from the kidney down to the bladder. It gives us a really good opportunity to connect that tube right to the bladder in a very close fashion, which minimizes the lack of oxygen and blood flow and nutrients to a ureter as it traverses a longer direction. Okay, so if we had to put it up here, that the blood supply of the donor ureter sometimes is weak further out from the kidney, and so the closer we can get it to the bladder, the further that optimizes healing and reperfusion of that new ureter. Okay, surgery takes about 4 hours. The process itself takes about 4 hours. The surgery itself takes about 2 hours. So going to sleep, getting prepared, getting prepped takes about an hour. Surgery, and then waking up takes about an hour. Okay, so it's a process that takes a morning, or an afternoon, depending on when it happens. Spend about 3 days in the hospital. You wake up with a catheter in your urethra, draining your bladder. 100% necessary, has to be there, can't be done without it. And the reason that is because we want your bladder completely drained and decompressed for that bladder ureter connection to heal well. Okay? Comes out usually before you go home. Do you currently make urine?
I do.
Good. And you're on dialysis, right?
Yes, I am.
Do you say a normal amount of urine?
I mean, yes and no. But I also take diuretics, so I'm sure that probably has something to do with it.
Okay.
I think maybe I can probably urinate maybe like a kilo maybe 2.
Okay. Any potential living donors at this point that you've identified or have identified you? No. And any abdominal surgeries?
No. Aside from some catheter removals.
Right.
Other than that, no.
And you mean catheter, the PD catheter?
Yeah, the PD catheters.
Did you have one revised or one had to be
I had one, it stopped working, then I had it revised, and then that one stopped working, and then I just had it removed entirely.
So what do you have now? You have a fistula?
I have a graft.
And so you started your PD catheter around May 2020, is that true?
I think so. I can't even remember when. I think that was the time. So let's, if we take out the other method of getting kidney.
Mm-hmm.
So average on a blood type. So my blood type's O. So on average, what am I looking at here? Like what wait time? Like 5 years, 6 years?
5 to 7, 5 to 8 years. Yeah.
That's what I thought.
It is a little bit longer. Are you also listed at UC Davis? Is that?
I am there.
You are. Good. Good for you. That's important. That doesn't hurt our feelings at all. You know, it doesn't change anything, it doesn't affect anything. It's you being responsible and showing us that you're very interested in doing what you need to do to get off dialysis.
Yeah, I would very much like to get off dialysis. Like, this is not fun for me.
Right.
And like, I don't want to do this anymore. Like, I don't want to be on dialysis anymore. But
right.
I mean, you know, if you're telling me that I got like a 7-year wait, you know, so I guess it doesn't really matter what I want. I just gotta wait.
Yeah. You had your recent left heart cath. That looked okay, as far as I can tell. Your stress echo that you had done in April, that looked okay. They had recommended that you start aspirin daily for life. Is that true?
What is that? The Lipitor?
No, just aspirin.
Aspirin? They didn't mention anything about aspirin.
Yeah, it said recommend aspirin daily for life. I wondered.
Yeah, they didn't mention to me about aspirin, so I just haven't been taking any.
Okay.
So why does it take so long if there's so many people just like dying and there's so many kidneys out there? Like, why does it take so long for like one person to just...
It's all about supply and demand. Unfortunately, in this part of the country, this part of the world, the supply is much less than the demand. And it's kind of a good thing, but also a bad thing. You know, the number of kidneys available for patients who need them is not as much as the people who need them.
So there's no, like, you can't get kidneys from like other countries, or... Because I'm 36 right now. So if I'm waiting like a decade to get a kidney, I'm gonna be in my mid-40s. So by then it's like, well, what's the point? Like most of the best years of my life are like way behind me. I'll be closer to 50 than I am, you know, than 30.
Yeah. I know.
So it's like, well, it's like, it's
so
life.
The thing that we say, and it's not an option for everybody because it's not something you can just create or pull out of thin air, but living donors are the best option. because
what I keep hearing.
you can get your kidney before, and you can also it lasts longer. It lasts about twice as long. A living donor kidney lasts about twice as long. And kind of in response to your other comment, it's not fair, and it's not something that I have an answer for. It's what our system supports right now. It's in the United States. It's leaps and bounds above what it is in other countries in terms of our development and how altruistic our donor population really is. A lot of countries, there's cultural limitations and prohibition against donating organs after death that have founded beliefs in religion and culture and all kinds of things. And unfortunately, where we are in the United States is the demand is in parts of the country much greater than what the supply is. And like I said, we don't want people dying in the streets just to be able to provide people who need kidneys. That's not a good societal outcome either. But what we try to do as surgeons is turn those tragedies and really unfortunate outcomes as people end their lives into something that can help others. And it's not always an easy task, and it's not always as straightforward as it may seem. Just why can't we just find kidneys and put them in anybody? That there's certain complexities that are based in science, biology, ethics, etc. And I understand the frustration. I get it, and I actually haven't had someone in a long time voice their frustrations as much as you, or just as simply as what you're saying. And I totally understand the complexities and frustrations around it.
Yeah, I think, I don't know. I think a lot of time it's just, you get a lot of people who really don't understand how big a deal this is. Especially the people I work at the dialysis centers are just oh, well, if you just get a kidney, everything will just go back to normal. And it's well, no, that's not exactly how it works. No. I'm going to be on immunosuppressants for the rest of my life. And, it's always this sort of sword of Damocles just hanging over me, constantly. Kidney disease, it's not something that you can. There's no cure for it. And that's one aspect that, especially my mom, she doesn't understand that. She thinks that, if you just pray to God enough, then he'll just cure you. And it's not how it works. This is a real thing. And this is a real thing that really affects me. And it's just, I got sick with something else that exacerbated this, which led me right to this.
What was it that got?
I got diagnosed with an autoimmune disease called HLH.
Yeah.
And they had to put me on chemotherapy and steroids and all those other chemo drugs. They had to put me on that stuff immediately. This was only 3 years ago.
Right.
So they had to put me on that stuff immediately.
Right.
And for a long time, I was in I was in really bad condition. I was sick for a year, and it took me a long time to recover from that. And then, the second all of the HLH and all that stuff was behind me, all the chemo and everything like that, once I was off all the drugs, my kidneys immediately started to fail, immediately afterwards. So I didn't even have time to even live just a little bit before I went from one tragic thing to another tragic thing. And now here I am on dialysis. So I had to wait. My life literally stopped. When I got sick with HLH, my life stopped entirely. I lost my job, everything. And I thought that when that part of my life was over, I would be able to recover and go back. And then I go to my nephrologist and she's telling me, oh, your kidneys, she tells me, oh, your kidneys are gone. And you need to start thinking about dialysis, immediately afterwards. So then it's my life ended again. Yeah. And now I'm in this stage where I'm 36 years old. I'm physically in my prime. I'm in my prime right now. And I still can't live because now I have to do this. And now I'm on dialysis. And it's not fun. I hate it. I absolutely hate dialysis. I can't express how much I hate doing dialysis. I hate how it makes me feel. I hate how much time my life revolves around it. Everything in my life revolves around dialysis and kidney disease. Everything in my life. And no matter what anybody says, like, oh, well, you can do this and you can't, you can do this, you can do, it's easy for them to say because it's not them it's happening to. You know, I can't do this stuff. There's certain things I can't do anymore. You know? And then, I gotta, I'm doing all of this stuff to get put on this list, and now I still have to wait. And by then it's just gonna be like, well, you know what? Then what's the point? Like, what is even the point? So that way I can enjoy what?
Well, I think
4 years.
That's what you have to decide. I mean, you're not. I have to clarify in my position that you do think there is a point to continue living. That's a question.
Oh, you're asking me?
Yes.
Oh, well, I mean, sometimes yes, sometimes no. Sometimes it's like when I say that, I like to clarify. It's not that I am saying I'm going to go home and hurt myself. That's not what I'm saying. What I'm saying, what I mean when I say that is, as a result of all of this, after everything that's happened, I'm starting to question the meaning of my life. I can't speak for anyone else, right? Like, if this is what I was put here to do, if you believe in the idea of creationism and Christianity, judo, the Judeo-Christian, creationism. Like, if this is what I was put here to do, and it's just like, well, I am the kind of person that, as opposed to believing in hopes and dreams, I'd rather put my stock in facts, in statistics, and results. So for me, it's like, okay, what? Like, I kind of want results now. You know what I mean? As opposed to just, oh, well, all these people around me are just like, oh, well, I'll pray for you. I'll do this, I'll do that. I'm just like, well, I could kind of use a kidney if you got a spare, As opposed to like, I don't know. But as far as like my quality of life, and the reality is, like, this is going to get more difficult. And the reason why I say that is because this is going to get more difficult for me as I get older. It's not going to be easy, and that's the reality of it. And as hopeful as people may like to be, and as much as they tell themselves that it's all going to work out, the reality is that it doesn't always work out for everyone. It just doesn't. That's not how it works. And it's going to get more difficult as I get older. So, like, if I were to get a kid, like, let's say, for example, like, I'm right now, right in this very moment, this would be the perfect time for me to get a kidney. Like, right now, like, I'm in the perfect shape as much as I can be. Like, for 3 years, I couldn't exercise, and I just recently got back into an exercise routine. Like, I do martial arts and stuff. I did it before I got sick. I did it for about 7 years. And for 3 years I had to stop because I was too sick to continue. Like, it's hard to hit a punching bag when you just came back from chemo. It's hard to do that after a dialysis treatment. But somehow, like, I'm making it happen. Like, this is the perfect time for me right now.
So
if I gotta wait like 10 years.
To reassure you, we frequently do this surgery on people, men and women, who are older than you and who have been on the wait list longer than the average time of 5 to 8, 7 years, etc. So you only have one choice. You have two choices. You can continue dialysis, or you can get a kidney transplant. And I totally agree with you. A kidney transplant is not magic. It's to me, I explain to patients, it's a form of renal replacement therapy that frees you up from having to go to dialysis 3 days a week. But it still requires discipline and devotion to keeping the kidney healthy and intact. And it doesn't come with without complications, potential issues, potential problems, follow-up, doctor's appointments, all those things.
Right.
And I hear you. I get it. That's why I went into this. to help people like you, to help improve your quality of life, to better what you're doing on a daily basis. The fact of the matter is you're, from the top down, you're the only person who can make the decision on what you do from day to day, right? We would be in your life and out of your life like that if you got a kidney transplant. And what I mean by that is we provide the avenue for you to potentially improve what life we all have left to live. You know, it's a finite and cherished resource that you have a palpable sense of above and beyond the majority of 36 and 37-year-olds in your boat, right? You have a sense of, like you say, kidney disease now follows you around. It's kind of this thing that, yeah, if I go to dialysis 3 days a week, I'm okay, but is that any way to live, you know? But if I have a kidney transplant, I'll be free from that dialysis and a better quality of life, but it's still, I fully recognize, I'm only saying that I hear you. I can't change that though, and you know that. And you're not, in the 20 minutes we've already spent together, your intelligence is far beyond and far above most people, how they conceptualize, the kidney transplant. I would say it's the best we have. Where you're at geographically, where you're at in your life right now with being listed here, being listed there, you're doing everything humanly possible to improve your current condition. Exercising, staying active, improving your mind, improving your body, those things are everything you need to do in order to prepare yourself for the kidney transplant. Whether I can say things that sound fatherly and patriarchal and say it's not worth wasting time over the thought of, I'm going to waste away for the next 5 years and then get a kidney transplant. I can say that I can guarantee you that if you continue down this road and continue the discipline that you're having, continue to stay active, continue to stay dedicated to your health, otherwise you will get a kidney transplant. And I do think that your life or quality of life will improve from that. But I hear you. I don't. It's not a. We're the same age,
Mm-hmm.
and you got dealt a bad disease that required heavy gun, chemotherapy that burned your kidneys, but otherwise, took care of the other portion of your disease.
I get that a lot too. Just nothing, and I understand. There's nothing in anybody, and it's just, if it came off aggressive, it's not you. It's not you. It's never.
It didn't.
It's never anybody. It's not. It's not anybody's fault.
Yeah.
It's not I wasn't just it's not my destiny. You know what I mean? I just don't believe in that. Some people do, they'll tell you, God chose you to see if you're strong enough. Strong enough for what? It's just I personally don't believe that. I am more in the space of just, sometimes things happen, things happen to people, it's a genetic roulette, the most perfectly healthy person can have cancer. It's not this it's not this ordained thing of you were born to do this thing, to perform this task. It's just, this is just what, this is just what happened to me, I hate the fact that this is what it is, and I have other people in the same age as me, they're living their lives and they're doing their thing, and my life just sort of stopped, and you constantly have these, and I understand that some of them probably mean well, and I do, but just they tell you what they think you want to hear, and it's man, my life just stopped, my life has just stopped, and they keep trying to rationalize to you that you can still live the same life that you always had, but that's not necessarily true.
It's not, but I think only you know the life you led prior, And you will know after you have a transplant the life you can live at that. And I can reassure you that people live very normal, fulfilled daily lives with a kidney transplant, taking a few extra medications, going to a few extra appointments, having follow-up routine health care examinations that most men, routinely put off until their 50s or 60s. Mm-hmm. You're already in the institution. You're going to be cared for a long time by doctors and nephrologists and immunologists and the like, and that process is just going to be part of your life, a part of most people's life that they don't experience until they're older. But I think that kind of fully understanding that I'm telling you and other doctors wouldn't be doing this if it didn't somehow improve people's quality of life along the way. It's a high-risk surgery, it's a high-risk operation, and the first thing that we looked at in kidney transplantation was, is it better than dialysis? And yes, from a health standpoint it is, and from a quality of life standpoint it definitely is. Those 3 hours that you spend hooked to a machine, you can be in the martial arts studio, exercising, and then have a job on top of that, Mm-hmm. So those are things that kidney transplants allow people to have. Even if you have to wait till you're 40 or 45, I can tell you beyond that, the survival benefits, if you have the will to live, which I believe you do, and to me it sounds like you have a lot of reasons to live, the health benefits of a kidney transplant versus remaining on dialysis are much better.
That's a concern of mine too. Like, I don't want to be on dialysis so long where, because I know that there are negative side effects to being on dialysis for long periods of time too.
Yes.
I understand that, and I wanted to not just be on dialysis for however long of my life,
Yeah.
It's and I look around at in the clinic and I see these older people on dialysis. It's I don't want to be like that, So it'll be easier for me to be healthier if I'm not on. Like you said, there's nothing that anybody can do. I'm a slave to the process.
The only thing, there are different places in the country, and I don't know if you have the resources, ability, etc., to be listed to allow you to get transplanted faster. That's not an option that I present to most people. But there are other parts of the world in the U.S. Where the waiting time is less than what it is out here.
I know Arizona is one of them I've done research on. Arizona, I think Texas maybe too.
Cleveland, Ohio, the Midwestern states, those areas, those places. But you need the resources to be able to go out there, get listed, get evaluated, etc., and then come back. So I'm assuming you still want to transplant.
I do. It's just. I mean, I guess I'm just mentally I'm in a place right now where I'm just I'm just still going through. I guess I'll always be going through the stages of grief with this. Yep. Even if I do get the kidney transplant, there's a possibility that it could still fail, and then I'll just be right back here again. And,
there is.
Yeah, I mean, I would very much like to get a kidney transplant. It's just the time, I'm still hung up on the time mm-hmm. that it'll take, and that's just, I guess that's the most discouraging thing about this whole process is just the time. And right now, even now, going through this, just even the whole process of me just getting to this point just felt like I was just wasting time. I've been on dialysis for a year in 3 months, and it's just man, all that time where I could have been.
Well, that the time's not wasted because the listing, you gain points for being from the start of dialysis, not from when we talk or decide that you're a candidate, right?
But it still feels I could be doing more productive things instead of just being on dialysis.
Right.
I could be working, I could be training, I could be you know, having normal relationships with like other human beings, you know, and these are things that, you know, unfortunately, and you know, people will try to rationalize to you that like, oh, well, being on dialysis doesn't stop you from doing anything. Try and explain that to like a potential girlfriend or potential date, you know, like trying to have to explain that to them, and then them having to look at you like, oh, well, I'll have to take care of this guy, and I don't want somebody that's sick in my life. Like having to explain to like your friends and family why you can't attend something. Oh, well, because I had dialysis and I feel like trash.
Yeah.
You know, for like the next 2 days.
Well,
you know,
I would say that
traveling, having to go somewhere. Oh, well, I can't go on vacation with you guys because I have to make sure that I'm either here or I have to coordinate a way to be at I have to be in close proximity to a dialysis center at all times.
Right.
You know.
So I can talk to you about the surgery. I think we're kind of getting beyond the boundaries of my specialty and my expertise.
Okay, I apologize.
No, you don't have to apologize. I appreciate the candor and the openness to talk to me about it. I think that my recommendation would be is some of these things are kind of on the borderline of things that may require a counselor or a therapist. And this is not me saying, I think there's people out there more suited than me or somebody on our team to help you kind of navigate those thoughts and those feelings. You know?
Oh yeah, I do. I speak to a therapist regularly.
Perfect.
Yeah.
And I think that's going to be really important because they're going to give you better strategies than me in terms of coping with. Well, I can tell you, yeah, your quality of life is going to improve. It's going to be healthier. The kidney transplant's going to free you up from doing dialysis. It's going to last about 10 years. This is what the surgery looks like. These are the risks of the surgery, you know, and the potential outcomes or complications that can occur. But you're kind of talking bigger and global. You know, like I said, when I snap my fingers, it's going to be like you're going to pass through Dr. Miller's care in a very, you know, quick period where this is much larger than the entire experience from being placed on dialysis to being, you know, transplanted. So.
Before I go, I did have a question about potential risk of cancer.
So the immunosuppressions, some of the immunosuppression medications always carry an increasing risk of certain skin cancers in some men and women. Okay.
So what about other organs?
So not really other organs. There's no really direct link between immunosuppression and organ-specific disease, but you can get lymphomas or leukemias as a result of the immunosuppression, what it does to your immune system. Those are kind of the big ones. Those are the risks of malignancies or cancers that are related to the immunosuppression itself.
What's the odds of that?
I'm not sure off the top of my head. You know, with the immunosuppression particularly, what you worry about is prior reactivation of certain viruses that are inborn or innate in all of us with the immunosuppression that can lead to cancer. But it's a low risk, and I think that we always said that the benefit of the transplant far outweighs the potential risk of getting one of those treatable illnesses.
Because I'm not too concerned about it, because if it was really like that big of a problem, like there would be more of like a hoopla over it. So since, you know, I haven't, because I do a lot of research about this kind of stuff. So since I haven't really heard anything about it, but I know that it's a risk factor. I read in the package you guys sent me that like cancer is a potential risk.
Right.
So I was just curious about that.
Let me listen to your heart and lungs. I know you have a cardiology appointment in a couple of minutes upstairs, right?
Yes. So what do you usually get? Like, what kind of responses do you usually get?
In terms of what?
Like, as far as, like, you know...
Well, people are just interested in, you know, the surgery, how long the kidney's going to last, and when they're going to get the kidney, and that's what I mean. I can tell you thought about this a lot, and it's you know, I wish there was a better way for me to answer your question and say, actually, no, if you do this, we'll get that kidney for you quicker.
Yeah.
You know, I think you should really consider the hepatitis C kidneys because they are an avenue to getting kidneys more quickly, and the studies that have been done thus far are very effective at treating the hepatitis C afterwards and curing it. And so it's a good way to get a quick kidney, not like overnight, but it opens a whole other population of donors that otherwise doesn't exist at this point. And we've had very good success in our program, and the program I trained at, we did, almost over 100 in the time that I was there, Cleveland Clinic. Examine your tummy. I think it's something that you should really, have an open mind to. I think that's kind of one of the potential avenues that will help free up or maybe potentially give you more options for transplants sooner rather than later. I'm just going to take a look at your belly and I'll tell you where we put our incisions. It would basically be, sorry, ticklish problem. I'm just feeling for the belly there. So I'm feeling for a bone here. We usually put the incision kind of from here to here, maybe a little bit lower, a little bit bigger. The bigger this girth is, the bigger the incision has to be. So anything you can do to lose weight or kind of decrease the amount of abdominal girth you have is obviously more beneficial to outcomes for the surgery, but not impossible.
Because I read about that too. Like people who are super overweight, they're asked to like sort of lose some of the like abdominal, like adipose tissue.
Yes, you're not there. If you had to walk 2 blocks, could you?
Slowly, but maybe.
Okay. Could you walk up 2 flights of stairs?
I could do it slowly, but I could. I get most of my cardio from the punching bag.
Okay.
And like I do like some moving drills.
Okay.
But like not like running or anything. Like it took me like a year to like be able to gain the ability to run again.
Okay. And that's kind of after the HLH was.
Yeah. Okay. Like I was bedridden for like 30 days.
Yeah.
It just happened one day. Like it just happened. Like I got sick one day. I was sick for like 3 days, and then I just went to the emergency room, and then after that I just didn't leave.
Yeah. Then what hospital was that at?
North Bay.
Okay.
Yeah. Vacaville.
Yeah.
Yeah, I wanted to say I really appreciate you listening.
Sure. So this is your CT scan from June, and what we look for here is basically, as a surgeon, I want to make sure that there's no other, obvious abnormalities or problems with other organs, and from the report, which is here. They basically said their biggest things were features of chronic renal dysfunction, which are just changes of the kidneys failing, right? And then we were looking for any kind of focal plaques or calcifications along the aorta or external iliac arteries, and I'll show you where those are. And that's what we're looking for there, is to make sure that there's a target for the kidney to soak in.
So that's not the kidney, but that one, that was like the spleen? Or?
That's your spine. This is the right side, this is the left side. So you're basically like this, okay? These are your kidneys that have failed. This is your liver. This is your spleen, okay? That's your spine. These are the muscles here that keep you upright as a human. They're always kind of on and firing to kind of keep you able to stand up straight. And they're anchored kind of down to your pelvis and your back up here. But the vessels we're looking for here is this big structure here called the aorta, and it bifurcates, which is a fancy word for splits at the level of the belly button, which is right about there.
So it goes here and here?
Yep, exactly.
To the major arteries in the leg?
Exactly. And you can kind of see here, this is a different view of it coming down.
So this is intestine too?
These are all intestines. This is large intestine, small intestine, large intestine coming down there. And then you can see right there, like I said, right at the level of your belly button, which is there, they split. They go into 2 tubes. They go this way, and they go that way. So what we're looking for there is any kind of changes or calcifications, plaque, atherosclerotic disease, which would prevent us from making a nice cut in the artery and sewing a new vessel to that. They look pristine, you're good to go.
Okay. Sounds good.
All right? Any other questions?
No, that was pretty much it. Yeah, you answered all my questions. I really appreciate it.
No problem. No problem. appreciate you and coming out to visit us and, you know, considering us as, you know, the physicians and doctors to be lucky enough to do your transplant. You know, we all take it very seriously. We take it, you know, possibly one of the most arduous and intense training that can occur in medicine is transplant surgery. So we all take our jobs quite seriously, and what we do day in, day out, we didn't go through it for nothing. And so when we meet patients who are able to kind of put their care and trust in us, we take it pretty seriously. We're always here. If you have other questions, concerns, comments, critique, judgment, or other, let us know.
Okay.
Okay? Nice to meet you.
All right. Well, it's nice to meet you, Miller. Thank you.
You're welcome. Good luck with the continued fight, and keep fighting. I promise you, once you get that kidney, you'll be happy you did. Or at least I you know, hope and wish that would be the outcome for you. All right.
Yeah.
All right. Have a good rest of your day, and then I think you're going upstairs to talk with cardiology about the results of the studies that were done.
Yeah.
And in Inland, right?
Yeah.
All right. Nice to meet you.
All right. Thank you very much.
No problem. Let us know if there's anything else, okay?
Okay.
Jennifer will direct you.